Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Balkis Kamarina binti Ahmad Zaki, and today I would like to do presentation of pneumonia. Okay, first let's begin. What is pneumonia? Pneumonia is the infection of the lung at the gas exchanges unit, which is the alveoli, that commonly caused by the microbe, which is viruses, parasite, fungi, and other infectant unit in either one or both lungs. This happens when the alveoli is filled with pus or fluid and making it difficult to run its function, which is for the gas exchanges unit of oxygen and carbon dioxide during breathing. Okay, next, let me take a look of the anatomical side of the disease of pneumonia, which is lung. It begins with the trachea, and we have the carina that divide the bronchus into the right main stem bronchus and left main stem bronchus. From the bronchus, it divided into the bronchi, and from the bronchi, we divided into the bronchioles, and at the end of the bronchioles, we have the alveoli. And for the lobe of the lung, we have two main lobes, which is right lobe and left lobe. And at the lowest part of the lung, we have the diaphragm. As been explained before, at the definition of the pneumonia infection happen at the alveoli, which is for the gas exchanges units. Okay, next, let me jump into the etiology of this disease, which is the main cause of pneumonia is the bacteria, viruses, fungi, and mycoplasma. For the complication of this disease that usually happen for the patient that have pneumonia is they might have the respiratory failure, lung abscess, emphysema that can cause the SOP, hypotension, which is the low blood pressure, septicemia, which is the poisoning that caused by the bacteria, and pleural effusions. Okay, for the next slide, let's we take a look of the anatomical classification of the pneumonia. There is three anatomical classification of pneumonia, which is bronchopneumonia, lobar pneumonia, and interstitial pneumonia. For the first one, which is bronchopneumonia, the infection happen around the bronchi area of the lung in patches. For the lobar pneumonia, the infection only involve in a single lobe or section of the lung. For the third one is interstitial pneumonia. The interstitial pneumonia happen when the infection only involve areas between the alveoli, and this is commonly caused by the viruses. As you can see at the diagram besides, the infection area is the yellow color one. For the type of pneumonia, there is 5 types of pneumonia. For the first one is bacterial pneumonia, the second one is atypical pneumonia, and the third one is aspiration pneumonia, the fourth one is the viral pneumonia, and the fifth one is the other type of pneumonia. For the first type of pneumonia, which is bacterial pneumonia, or also can be called by the pneumococcal lobar pneumonia, which is it only occurs when the system immune is weakened, and it also can affect the entire alveoli lobe of the lung except bronchi itself. The common type of bacteria of this type of pneumonia is Streptococcus pneumonia. The second type of pneumonia, which is atypical pneumonia, or can be called as a mycoplasma pneumonia, it's happened by the bacteria, and it also have the different system and physical sign that occurs in all age of groups. For the third one is the aspiration pneumonia. Aspiration pneumonia occurs when the acid vomitus aspirate into the lower respiratory tract. It also can cause the chemical pneumonitis. For the fourth type of pneumonia, which is a viral pneumonia, it caused by the viruses, including the flu. And the last one is for the other type of pneumonia, it can cause by the other infection also, and it's less common in fungi. Okay, next, let me go to the clinical classification of pneumonia. The clinical classification can be divided into four main routes, which is the first one is community-acquired pneumonia, the second one is pneumonia in elderly, the third one is pneumonia in immunocompromised host, and the fourth one or the last one is nosocomial. For the community-acquired pneumonia, it can be divided into three, which is atypical, typical, and aspirations. The difference between typical and atypical is typical have more classical symptoms, but atypical it have pulmonary and extrapulmonary symptoms, and atypical also may have insidious onset. For the aspiration, it's happen when the food, saliva, liquid or vomit is breathed into the lung or airways leading to the lungs instead of being swallowed into the esophagus and stomach. For pneumonia in elderly, it involves in older people. And pneumonia in the immunocompromised host is a complex infection and inflammation of the lower respiratory tract. For the nosocomial pneumonia, it divided into three, which is HAP, VAP, and HCAP. HAP is a hospital-acquired pneumonia, VAP is ventilator-associated pneumonia, and HCAP is healthcare-associated pneumonia. Okay, next, let me take a look of the manifestation of pneumonia, which is its symptom and signs. Symptom of pneumonia can be divided into two, which is respiratory symptom and non-respiratory symptom. For the respiratory symptom, they might have productive or non-productive cough, SOP, which is short of breath, and difficulty in breathing. For the non-respiratory symptom, they also might have a fever, headache, sweat, fatigue, myalgias, which is muscle aches, and they also might have a change in their mental status. This symptom related to their age. As the age increases, the respiratory symptom and non-respiratory symptom will be decreases. Okay, next, let me take a look of the sign of pneumonia, which is the first one is the temperature will be elevated, and the second one is the respiratory rate or the RR rate will be increases. The third one is hypotension, which is a low blood pressure, and the fourth one is tachypnea, which is a fast in breathing, and the fifth one is a cyanosis, which is a bluish color discoloration of the skin, and the sixth one is the cracker sounds when breathing, and the seventh one or the last one is the hypothermia or hyperthermia. Hypothermia is an increase in body temperature, while the hypothermia is the decreases in body temperature. Okay, next, let me move on to the pathophysiology of the pneumonia. This disease happens when the infectious agent or bloodborne organism or any foreign substance enter the blood circulation. It also can be happen if the aspiration of the gastric contents occurs. From these two, can cause the inflammation of the pulmonary tissue. If the inflammation of the pulmonary tissue occurs, it can cause two side effects, which is the first one is alveoli will fill with exudates, and it will cause the inhibit of diffusion of oxygen and carbon dioxide. And the second one is mucosal edema occurs at the alveolar membrane that can cause the occlusion of the alveoli. When inhibit diffusion of oxygen and carbon dioxide and occlusion of alveoli occurs, it will cause hypoxia, retention of carbon dioxide, short of breath, SOP, fatigue, and lung crackers. Okay, next, let me move on to the modality that used to diagnose the pneumonia. There is three modality we can use for pneumonia, which is the first one is chest X-ray, the second one is computed tomography, CT scan, and the third one is MRI. For the first modalities, we have chest X-ray. The advantages of chest X-ray is because it can detect the early confirmations, and we can also know the presentation of the pneumonia. And it also can demonstrate the abnormal pulmonary opacity of the lung density and lobar consolidations. And it also can determine the location of extended inflammations. But the chest X-ray also have its limitation, which is it less efficient in diagnosing and underlying details. It also not useful for the diagnosing low clinical probability, and it also not sufficient to detect finding of extended infection of complications. The second modality is CT scan, which is computed tomography. For the advantages of CT scan, it be the gold standard for diagnosing the pneumonia and underlying primary process. This is because it can show the neoplasm, foreign body, or any secondary complications. It also can show the finer details within the lungs, airway, trachea, and bronchi. Besides, it also can show the complication of pneumonia, abscesses, pleural effusion, enlargement of lymph node. For the limitation of CT, it's contraindicated for the pregnant patients, renal failure patient, and contrast allergy patient because some of the examination might use contrast media. It's also longer time, and it's also use a large amount of radiation dose. Okay, next, for the third modality we use in diagnosing pneumonia, we have the MRI. For the advantages of MRI, it mostly and commonly used for the adult outpatient of pneumonia because it applicable for diagnosing the lower respiratory tract infections. It also applicable to detect and noticeable the pulmonary consolidation and inflammation. It's similar to the HRCT, but it not generally used. Okay, next, let me move on to the radiographic appearance. For the first image appearance, we have the chest X-ray. As you can see, figure shows the staphylococcal pneumonia of 20 years old man. At the blue area, it shows the multiple large pneumotor cells at the right lung, while at the red circle, it shows the consolidation of lower left lobe of the lung. Next, let me move on to the second image appearance, which is for the CT scan. As you can see, the figure show pneumonia that caused by the adenovirus of 20 years old man that have sign and symptoms such as the fever, cough, and dyspnea. As you can see, at the blue arrow, it shows the patchy of ground glass opacity, and at the yellow arrow, you can see the lobar consolidation of pneumonia. Next, we go to the technical consideration. For the chest X-ray, we need to do PA erect because we want to see air fluid level, and we also need to do lateral erect chest X-ray because we want to see the left lower lobe of pneumonia, and it also can show the respiratory distress, which is the hyperinflation of diaphragm. The second one is for the CT scan, computed tomography. We also need to use the lung window because it can wipe out the mediastinal and chest wall structure. This is so that we can see the lung tissue in detail area, which is the consolidation and pulmonary vascular structure. For the third one is MRI. MRI should be used for kids and pregnant women that have pneumonia because they have no radiation and sedation of anesthesia. For the fourth one, we need to use the short exposure time because pneumonia patient cannot hold their breath any longer, and they also have dyspnea and chest pain. The last one is for the use of contrast media in CT. We might need the consent for the allergic patient, pregnant women, or renal failure patients. There are a few choices of imaging modality that can be used to diagnose pneumonia, but the best one is CT scan because chest X-ray can be used for to confirm pneumonia, but CT is the gold standard in finding pneumonia because it shows more details and accurate method to identify pneumonia. That's all from me. Thank you.